We welcome you to our module Specified Heart Arrhythmias, HCC 96 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of specified heart arrhythmias.
At the end of this module, the learner will be able to differentiate among bone, joint, muscle infection and necrosis. Discuss the criteria for the documentation of these diseases. Identify the ICD-10 codes that fall under the purview of bone, joint, muscle infection and necrosis. Review the example of the assessment and plan for these diseases.
Heart arrhythmia describes an irregular heartbeat. The heart may beat too fast, too slow, too early or irregularly. It is also called as arrhythmia, dysrhythmia or irregular heartbeat. Heart arrhythmia occurs when the electrical impulses to the heart which coordinate heartbeats are not working properly. It can be further divided into slow heartbeat, known as bradycardia, fast heartbeat which is also known as tachycardia, early heartbeat which is classified as premature contraction and the most common form of cardiac arrhythmias, irregular heartbeat which is known as atrial fibrillation, AFib. A person with healthy heart usually has a heart rate of 60 to 100 beats per minute while resting, and it is quite uncommon for a healthy person to suffer from chronic arrhythmias unless it is triggered by an external factor such as drug abuse or an electric shock. However, when there is an underlying problem, the electrical impulses may not be able to travel through the heart correctly, resulting in arrhythmias. There are some related diagnoses under HCC 96 which include premature junctional contractions, PJC, atrial fibrillation, AV block complete, atrial flutter, paroxysmal tachycardia, and sick sinus syndrome, SSS. The main criteria for documentation of heart arrhythmias is a physical examination and/or EKG. Next, let's look at the HCC codes for specified heart arrhythmias. Code I44.2 is for a complete AV block, with the hierarchical condition category being 96. For unspecified paroxysmal tachycardia, the code is I47.9, HCC 96. When the condition is unspecified atrial fibrillation, the code is I48.91, HCC 96. It is followed by unspecified atrial flutter, whose code is I48.92, HCC 96. In case of premature junctional contractions, the code is I49.2, HCC 96. And lastly, for sick sinus syndrome, the code is I49.5, HCC 96. The assessment and plan should address the diagnosis and include two support indicators. Following is an example of the final diagnosis documentation. Patient name, Casey Parker. Date of service, April 25, 2019. Date of birth, December 31, 1976. Assessment documentation. Paroxysmal SVT stable on metoprolol succinate 75 mg once daily. Continue with Dr. Johnson, cardiologist. Has a follow-up next month. Stable follow-up with any chest palpitations. Exceptions. However, there are a few exceptions which are to be kept in mind while writing the progress note. Sick sinus syndrome cannot be coded when a patient has a pacemaker with no complication of pacer. Controlled rhythm. No other complication. We have reached the end of our short refresher course on specified heart arrhythmias. We introduced you to specified heart arrhythmias, touched upon the types of arrhythmias, their causes, the specific codes related to heart arrhythmias, the assessment plan and the exceptions which are to be kept in mind while creating the progress note. Thank you for joining us.